Good evening. I'm Dr. NIKHIL ASIJA, junior resident in MGM Medical College and Hospital, Navi Mumbai. Today, my paper presentation topic is role of MRI in evaluation of uterine fibroids using the FIGO classification system. My co-author and guide is Dr. Gayatri Patil. Introduction. Uterine fibroids are the most common benign tumors of the uterus in reproductive age of women. MRI is the most accurate imaging modality for detection, localization, and characterization of the fibroids. The FIGO classification system standardizes reporting and helps guide clinical and surgical management. Aim of my paper is to study the role of MRI in detecting, characterizing, and classifying uterine fibroids. Objectives are to detect and characterize uterine fibroids on MRI to evaluate size, number, location, and extent, to classify fibroids using FIGO classification to assess associated degenerative changes. Materials and methods, study design, retrospective observational study conducted in the Department of Radiodiagnosis of MGM Medical College, Kamute. Study population 8 female patients, age range 20 to 60 years. Patient referred to pelvic MRI for pelvic MRI with suspected fibroids. Equipment is 1.5D Toshiba scanner and 3D Philips and Genia MRI scanners. MRI protocol uses T1 weighted, T2 weighted multiplanar, stir and fat suppression, DWI, and post contrast if needed. Parameters evaluated are location, submucosal, intramural, or subserosal, signal intensity, enhancement, degeneration, and FIGO classification. Here is the FIGO classification of the fibroid. First is type 0, which is intracavitary. Then are type 1 and 2, which are submucosal. And then is type 3 and 4 intramural fibroids. Type 5 to 7. Type 5 is subserosal and greater than 50% intramural. Mural. Type 6 is greater than 50% subserosal and less than 50% intramural. And type 7 is subserosal pedunculated fibroid. Type 8 is other fibroids like broad ligament fibroid. Here are some slides of the FIGO classification of the fibroids, and next I would move on to the cases. First case is a 45-year-old female with menorrhagia. Multiple well-defined rounded altered signal intensity lesions appearing inhomogeneously hypointense on T2 and STIR are noted involving the intramural and subserosal planes of fundus, anterior and posterior wall of the uterus, which are classified as FIGO 2 to 5 fibroids. As you can see, the yellow arrows are depicting the FIGO 2 to 5 fibroids. Few of these lesions are noted involving the submucosal plane of the uterus extending into the endometrial cavity, as seen in the as marked by the red arrows, which are FIGO 1 fibroids. Case 2 is a 32-year-old female with infertility. There is a well-defined rounded alter signal intensity lesion appearing inhomogeneously hypointense on T2 stir involving the submucosal plane of the uterus extending into the endometrial cavity suggestive of submucosal fibroid. It comes under the FIGO classification of 1. And case 3 is a 40-year-old female with abdominal pain. These are the T2 and star sequences of the patient. You can see a well-defined, rounded, altered signal intensity lesion noted involving the intramural plane of anterior wall of the uterus. It appears inhomogeneously hypointense on T2 and star sequences. It is indenting and displacing the endometrium posteriorly. The FIGO classification for the fibroid is 2 to 4. It is marked by the yellow arrow in the given pictures. A well-defined similar morphology pedunculated lesion is seen noted arising from the upper segment posterior wall of the uterus, which is FIGO 7, marked by the red arrow. Case 4 is a 35-year-old female with menorrhagia, well-defined, rounded, alter signal intensity intramural lesion, more than 50% intramural lesion with small exophytic component arising from the fundus and left lateral wall of the uterus, likely suggestive of a fibroid, FIGO type 5. Case 5 is a 37-year-old female with dysmenorrhea. You can see a well-defined, rounded, altered signal intensity lesion noted involving the transmural plane of anterior wall of uterus. It appears inhomogeneously hypointense on T2 and STIR. Few T2 and STIR hyperintense cystic areas are noted within it. It is indenting and displacing the endometrium posteriorly. It is FIGO 2 to 4 fibroid. Case 6 is a 42-year-old female with lower abdominal pain, and you can see a well-defined lobulated altered signal intensity lesion appearing hyperintense with few hyperintense cystic areas on T2 star sequences in the right parametrium, showing few cystic areas likely suggestive of broad ligament fibroid with cystic degeneration. It comes under the FIGO 8 classification. Case 7 is a 56-year-old female with abdominal pain, a well-defined rounded altered signal intensity lesion appearing iso to heterogeneously hyperintense on T2 and STIR images with few peripheral vascular channels involving the intramural plane of the posterior wall and fundal region of uterus, suggestive of large intramural fibroid with myxoid degeneration, FIGO 4 classification. And the discussion of the research paper is MRI provides excellent soft tissue contrast and precise fibroid mapping. Typical fibroids appear T2 hypointense with whorl pattern. Degenerative changes alter signal characteristics. Like in red degeneration, the fibroid is T1 hyperintense. In cystic degeneration, it is T2 hyperintense. And in myxoid degeneration, it is T2 heterogeneously hyperintense. Whereas in sacromatous degeneration, the fibroid is irregular, ill-defined with T2 heterogeneous signal. FIGO classification plays a crucial role in surgical planning, fertility assessment, selection for uterine artery embolization. The strengths of the study are superior soft tissue contrast, accurate localization and mapping, detection of degeneration, pre-treatment planning. Limitations are cost, availability, motion artifacts, and small sample size. Conclusion is MRI is a gold standard modality for evaluation of uterine fibroids. The FIGO classification system provides a structured approach for reporting. Combined user improves diagnostic accuracy and guides optimal patient management. And thank you. That was my research paper.